I'm Dr. Katie Tolbert. I'm a clinical veterinarian at North Carolina State University, and I also hold a position as clinical associate professor at Texas A&M in the gastrointestinal laboratory. My research is changing over time, but definitely the focus is mostly in small animal gastroenterology, so diagnosis and treatment of gastrointestinal diseases of dogs and cats. Yeah, so we just received a grant from one of our industry partners named Trivium Vet, which is a really great, relatively small company in Ireland, and they have been working with us for quite some time. Actually, we just finished up a study looking at an omeprazole product, so a gastric acid suppressant for the treatment of ulceration in dogs. And this is a new study that they just launched, which is for the diagnosis of early intestinal permeability, increased permeability in dogs. And so the project itself is actually, we're going to be focused on soft-coated wheaten terriers because we recognize that that breed specifically gets a disease known as protein-losing enteropathy, where they start to lose proteins through their gut. And so one of the first things that we need to try to do is identify these dogs more quickly and early so that we can target intervention earlier in the course of the disease, and that way we might be able to slow the progression of disease in these dogs. And so we are going to be recruiting both healthy soft-coated wheaten terriers as well as soft-coated wheaten terriers who already are known to have gastrointestinal disease to enter into this study to detect increased intestinal permeability in these dogs. We have a few collaborations. The main one that we have for this particular study with Trivium Vet is Dr. Mark Papich, who's a pharmacologist here at NC State. So in the future, if this diagnostic test does end up being a good test to identify early intestinal hyperpermeability in dogs, we hope that it will become widely available to be used as a diagnostic marker, both for breeds that are known to be at risk for intestinal diseases, but also in those cases where we're not really sure if the disease is actually gastrointestinal in origin or perhaps somewhere else like the urinary tract or the liver specifically.